Hello students, welcome to our channel Community Medicine Made Easy. Today we are going to see about the chapter on maternal and child health. The first part of the video is preventive obstetrics. In this video I am going to cover the antenatal, intranatal and postnatal part. In the next video I will be putting up the child care part 2, and in the part 3 video I will put up the remaining. In every video we used to do some innovation, and here in this video for revision of this chapter I am going to discuss the key points. In this chapter you have to remember that the points will be repeated many times. That's why you have to remember the key points. With the help of key points you can answer any question. Okay, now let's quickly get into the chapter. So the first one is antenatal care, introduction, objectives and the components we are going to deal with. So antenatal care is the care of the woman during pregnancy. So the objective, the ultimate aim is to have a healthy mother and healthy baby, and the third most important thing is notification of pregnancy to health authorities. So what are the objectives of antenatal care? Please remember, you have to just remember these 8 points by heart. So to remember these 8 points by heart, I am going to give you a mnemonic for you to remember. Now the first point is to promote, protect and maintain the health of the mother during pregnancy. So the first point here is health. So the first point here is health. Next is to detect high risk cases during pregnancy. So the second point here is risk. Next is to foresee complications and prevent them. So next point is complications. Next one is to remove anxiety and dread associated with pregnancy. So anxiety. To reduce maternal and child mortality and morbidity. So here we are dealing with MMR. Then to teach mother elements of child care, nutrition, personal hygiene and environmental hygiene. So here basically we are educating the mother. Seventh point is to sensitize the mother to the need for family planning, including advice to seeking MTP. So here it is family planning. And the 8th point is to attend to under 5s, that is children accompanying the mother. So these are the 8 points. So these are the main objectives of antenatal care. So how to remember this? I can give you a suggestion that you first combine the first 4 points and then create a mnemonic, and then the next 4 points and then create a mnemonic. The first 4 point we can write like health is health will be more when there is less risk, less complications and less anxiety. Do you understand? And then so that is the first part. Second part is MMR will be less when there is good education, when there is family planning, when there is good care of under 5 children, right? That's all about the objectives. Next is the components. What are the components of antenatal care? These are the 6 main headings under which we are going to actually discuss, and it is related to the mnemonic which we framed here in the previous slide. If you see, the mental preparation is related to the anxiety part, that is the 4th part. It is related to the anxiety, the mental preparation part, and then family planning we discussed, that was there, and then we discussed about the under 5 also, that is the pediatric component here. See, the antenatal visit and prenatal advice, that is the health part which we discussed initially, the first part, and then the specific health protection we can associate with complication. To reduce, when there is to reduce the complication, we have to give specific protection measures, right? So in this way you can remember the components, and so we are going to now discuss under these 6 main headings what are the components of antenatal care. First one is the antenatal visit. You have to remember at least there should be 4 antenatal visits, first, second, third and fourth. This is the first visit in the first trimester, the second visit in the second trimester, the third visit is in the third trimester, and the fourth visit is also in the third trimester. So this is the minimum number of visits that should be undertaken when there is a pregnancy. But ideally, how many visits a mother should go during the first 7 months? At least once they have to go. During the next month, they have to go at least twice. And then thereafter, after the 8th month, the woman has to go once a week. So once a month, twice a month, and then once a week. Next, it is advisable for the woman to visit medical officer at the PHC for antenatal checkup during the period of 28 to 34 weeks. Besides this, she may be advised to avail investigation facilities at the nearest PHC. Registration of pregnancy should be done within 12 weeks. That is the prime responsibility of the auxiliary nurse midwife in that village area. Opportunities such as village health and nutrition day should be availed to ensure the early registration of pregnancy. So it's very, very important. And antenatal checkup. This is very, very important because if you detect the problems early, we will be able to give solutions early. So how the ANM will estimate the number of pregnancies in her area? So this is the expected number of live births per year in her area. So in her area, like what is the birth rate per 1000 population, and then what is the population of the area. Birth rate is standard, it will be available based on the records. So based on the previous record of birth rate, we have to calculate, multiply it by the population of the area and divide it by 1000. We will get the expected number of live births per year. So this is called as Y. So this is the Y we are going to calculate, the ANM should calculate. So after the calculating Y, what she has to do, she has to give a correction factor because it is a expected number of live births would be an underestimation usually. So that is why we are giving a correction factor of 10%. So we are using the number which we got from Y, and we are going to calculate the expected pregnancies, which is called as Z. So Z is equal to Y plus 10% of Y. So this is the formula we use to calculate the expected number of pregnancies by the ANM. So as a thumb rule, in any given month, approximately half the number of pregnancies estimated above should be in record. So this is what is very important here. The half the number of pregnancies should be in the records. Half of Z. So this is the formula. So this is the rule. At least we calculate the number Z. So in a month, in any given month, the woman should have examined at least Z by 2. At least half the pregnancies she should have, that should be in the record. So the first antenatal visit, what are the things that will be done? The history taking, physical examination, abdominal examination, assessment of gestational age, and lab investigation. So what are the lab investigations we do? Pregnancy test, hemoglobin, urine test for albumin, sugar, rapid malaria test. This can be done at subcenter level itself. But when there will not be a lab in subcenter, but in the PHC there will be a lab. So there we can do blood grouping for and RH factor, VDRL, HIV testing, rapid malaria test, blood sugar testing, and HBS antigen for Hep B infection. So what are the essential components of every antenatal checkup? Take the patient's history, conduct a thorough physical examination, conduct a thorough abdominal palpation for fetal growth, and carry out lab investigation. So it is nothing but same like your case sheet history taking in your clinical examination, how you do the same thing only we have to do. We have to follow this protocol in your practice. So what are the intervention and counseling measures? So these are very specific, which will be repeated again and again. The iron and folic acid supplementation should be given for 100 days, 100 milligram iron and 0.5 milligram folic acid. Immunization against tetanus, we have to give at the 5th month and 7th month. If the second pregnancy is within 5 years, we can give only 1 dose of tetanus. But if the second pregnancy is after 5 years, we have to give 2 doses. And then regarding nutrition, family planning, self-care, delivery, and parenthood, we have to give counseling, and then home visit by female health worker and trained DAI. They will give supplementary nutrition during this time. They will give health advice. They will check for BP, and then referral services where necessary. If the BP is high or if the blood sugar level is high, she will be referred to the higher center. Inform the woman about the benefits, Janani Suraksha Yojana, and other incentives given by the government. Next, this is the most important question for you in this antenatal care: risk approach. The risk approach is we are identifying the high risk woman. We are giving the appropriate intervention. It will help in management of the resources, and it will help in the outcome of the pregnancy. If you identify the woman early, it will help in good pregnancy outcome. So what are who are all called as high risk mothers? To remember who are high risk mother, you can remember some pictures here. First one is the demographic parameters, the age more than 30 years, or height less than 140 centimeter, or if the mother is a elderly grand multipara. This is the initial part. Okay, this is the first initial part, the age, height, and elderly grand multipara. If these three factors are there, we say a high risk mother. Okay, this is the first picture. Okay, what is the next picture? Just remember a BP machine, the sphygmomanometer. Okay, the sphygmomanometer, if you remember, you can very well say about preeclampsia, eclampsia are risk factors for pregnancy. So remember the BP machine. Next thing we have to remember is pallor of a mother. So the pallor of the mother, just remember in your mind the picture of you are seeing a pallor. So this says the women who are anemic or high risk mother, and the outcome of anemia is intrauterine growth retardation and intrauterine death. So history of intrauterine death is a high risk mother. Another outcome of anemia is stillbirth. The baby will be born dead because of anemia. So this is also outcome. So history of stillbirth is history of stillbirth says she is a high risk mother. Then so this is the first picture, second picture. Now the third picture you have to remember is a mother with a tummy, big tummy big. So what it means is she is having two babies inside. So it can be twins. And naturally when the tummy is big, when there are two twins, definitely the fluid will be high. So the polyhydramnios, the hydramnios can occur, or sometimes oligohydramnios can be there. So just to remember the points I am telling this. So this picture, if you remember, you can remember twin pregnancy, polyhydramnios, oligohydramnios are all risk factors for high risk mother. And then the fourth picture you have to remember is the picture of a forceps. An instrument. So when you remember the picture of a forceps, when there is history of LSCS, lower segment cesarean section, when there is history of instrumental delivery, history of manual removal of placenta, so these are all coming under the forceps picture. So if you remember the picture of the forceps, you can remember these points. And then the last one is the systemic disorders like hypertension, diabetes and other things. And another one is treatment for infertility and abortion. For infertility and abortion. So these are all examples for high risk mother. So remember the first one is age and the related factors, age, height and elderly factor, followed by first picture BP picture, second picture the pallor, the third picture the mother with a tummy, big tummy, and the fourth picture forceps, and then two additional points. So in this way you try to remember who is a high risk mother. So this is about the risk approach which I told you before. It is a managerial tool involved in MCH care. The purpose is to provide better services for all with special attention to those who need them most. Next one is DAI card. This DAI card is a mother and child protection card for every woman who is registered. I told you before, the woman should be registered. For every woman who is registered for pregnancy, there will be a DAI card containing all the data, number, data, previous history, main health events. So this will be, the mother should be instructed to bring the record with her during all subsequent checkup. And this card is developed by Ministry of Health and Family Welfare and the Ministry of Women and Child Development. Next one is the prenatal advice. So what is the prenatal advice? We have to give diet, personal hygiene, drugs, radiation, warning signs and child care. So first one is the personal hygiene. So in personal hygiene, the cleanliness, how many hours they have to sleep, like 8 hours they have to sleep, 2 hours, 8 hours in the night they have to sleep, 2 hours in the afternoon they have to sleep, regular bowel habits, exercise, regular exercise, mild exercise, not aggressive exercise, avoiding smoking, alcohol, dental hygiene, and avoiding sexual intercourse during the initial months and the third trimester. So these are all the points for personal hygiene. Then what are the warning signs of pregnancy? Swelling of feet, fits, headache, blurring of vision, bleeding or discharge PV. All these are warning signs for the high risk problems which we earlier discussed. Next one is the teaching them mother about mothercraft, that is health education regarding nutrition, advice on hygiene, child rearing, cooking, family planning education and family budgeting. So what are the specific health protection measures? These are very important. Anemia, giving 100 mg elemental iron, 500 mg, that is 0.5 mg folic acid for 100 days. If the mother is anemic, you have to give twice the dosage, that alone you remember. Then other nutritional deficiencies, so we give prophylactic vitamin A and vitamin D, and then for toxemia of pregnancy, if it is there, we have to give appropriate blood pressure reduction tablet. And then for tetanus, I already discussed, first dose 16 to 20 weeks, second dose 20 to 24 weeks we have to give. Syphilis, 10 daily injections. Suppose if it is mother is positive for syphilis, we have to give procaine penicillin 6 lakh units, 10 doses daily. And then German measles, before pregnancy itself, we have to vaccinate the mother for German measles, rubella vaccination we have to give. We cannot give the vaccine after pregnancy. So this is before pregnancy. Next is the RH status. The RH status of the mother, we have to see whether if the mother is RH negative and the husband is RH positive, we have to test for whether the baby is RH positive. If suppose the baby is RH positive, so we have to give RH anti-D immunoglobulin at 28 weeks of gestation, and the second dose we have to give 72 hours after delivery. So 2 doses of RH anti-D immunoglobulin we have to give to prevent the cross immunity and hydrops fetalis in the baby. And we have to give counseling and mental preparation of the mother for child rearing and taking care of herself. And then family planning advice is, this is the right time to give family planning advice. So the pediatric component, all the antenatal clinics will have the pediatrician should be there, and they will give care for the under 5 children. And then this is all about antenatal care. Now the intranatal care. So the intranatal care mainly involves the hygiene during delivery, and for remembering the hygiene during the delivery, we use the mnemonic 5 C's. You all remember: clean hands and fingernails, clean surface for delivery, clean blade for cutting the cord, and clean tie of the cord, and then clean birth canal. So these are the 5 C's. So this is what I was discussing, 5 C's. Next, what are the aims of good intranatal care? This is about thorough asepsis, delivery with minimum injury to the infant, readiness to deal with complications, and care of the baby at delivery, resuscitation, care of the cord, care of the eyes. Sometimes the mother will like for domiciliary care, where that is in their own house. So what is the advantage when there is a delivery is happening in the house? It is a family surrounding in her own house, and then there is less chance of cross infection. Mother is able to keep an eye upon her children after the birth of the baby. But the disadvantage, there is less medical supervision than in the hospital, and the mother's domestic duties may resume too soon and the diet may be neglected. So what are the danger signals during the intranatal period? Sluggish pain or no pain after rupture of membrane, good pain for an hour after rupture of membrane but no progress, prolapse of the cord or prolapse of the hand, meconium stained liquor, excessive show or bleeding during labor, collapse during labor, placenta not separated, postpartum hemorrhage or collapse, temperature 38 degrees or over or more during labor. About 1% of the deliveries tend to be abnormal or difficult, requiring the service of a doctor. So this should be dealt only in an institution. The mother will be given complete bed rest. She will be treated there. At least for minimum 5 days of lying in period after normal delivery is recommended. Rooming in the baby after the delivery, the baby will be kept near the mother, by the side of the mother. This gives the opportunity for the mother to know her baby, better chance for breastfeeding. Also, the fear in the mother's mind that baby is misplaced in the nursery will be alleviated, and it builds up her self-confidence. So the last part is postnatal care. What are the things under postnatal care? The care of the mother, complications, restoration of the mother, breastfeeding, family planning, and basic health education. But the most important thing to remember here is, this is a combination field where the role of obstetrician, pediatrician, and perinatology comes in. And the care of the mother is the most important thing here. Here that these four main complications, just remember it by heart. During postnatal period, we have to look for puerperal sepsis, puerperium 6 weeks after delivery. So we have to be on lookout for puerperal sepsis. If the mother is bedridden for too long, she can develop thrombophlebitis, and then sometimes there could be secondary hemorrhage, which is possible. It is not reactionary hemorrhage which comes immediately after delivery, but this is secondary hemorrhage which happens 48 hours after delivery. So you have to be on lookout first for hemorrhage, next for thrombophlebitis, and then for puerperal sepsis. And there are some minor complications like UTI, urinary infection, and mastitis can occur, which should be treated with appropriate antibiotics. So the main aim during the postnatal period is complete restoration of physical, psychological, and social health of the mother. And here the most important point is regarding breastfeeding. The breastfeeding should be initiated as early as possible, and the normal Indian woman able to lactate about 400 to 600 ml of milk per day, even if she is from a lower socioeconomic status, poor status, it doesn't matter. The woman has the capacity, Indian woman. This is what the studies have told. So the mother should be encouraged to start breastfeeding as early as possible. And at the age of 6 months, breast milk should be supplemented by additional foods rich in protein and other nutrients. So these are called supplementary foods. So this will be slowly introduced. And then lastly, regarding the family planning, postpartum sterilization is advised on the second day after delivery if the woman is having more than 2 children. And then IUCD is advised after 6 months. Immediately after delivery, you cannot advise IUCD because the uterus will be soft. It can cause perforation. And then immediately after delivery, it is the hormonal contraception which is advised. Basic health education regarding environmental hygiene, feeding of mother and infant, pregnancy spacing, importance of health checkup, and birth registration should be given. So that's all about the first part, that is care of the mother. The preventive obstetrics is over for you. And in the second part of the video, we will deal with the care of the children, and then the growth chart and other child health components. If you like this video, kindly subscribe our channel Community Medicine Made Easy and put a like button below this video. Thank you so much.